Okay.
Hi, I'm Dr. Chris Salerno. I'm the chief editor of Dental Economics, and I am joined right now by one of our esteemed endodontic colleagues, Dr. Marwan Abou-rass. It's also a pleasure to call him a friend over the past few years. Dr. Abou-rass is very well published. He's published a textbook, numerous articles, held academic positions, really one of the world's foremost experts in endodontics. Dr. Abou-rass, it's a pleasure. How are you?
Fine, thank you. Hi, Chris. Good morning.
Good morning. So we're here to announce a very special course that you have developed, and it's not doing it justice to just call this a CE course. This is really a master class in endodontic diagnosis that you've put together. It spans multiple hours, and it's broken up into 5 different sections. It's titled Towards Better Understanding of Cracked Tooth Problems in Dentistry. And you know, there's a lot more that this course goes into than just cracked teeth. It's really walks everyone through the endodontic diagnosis procedure that every dentist should have in their practice. Can you tell me a bit about some of the frustrations you have as you lecture to dentists and endodontists about their inability to correctly diagnose or even use inferior tools to correctly diagnose problems?
Chris, may I start? I personally have suffered from the problem. I have lost 3 molars because of the cracked teeth problem back in the early 80s because of occlusal problems. So it started with me personally. And then back in 1983, I published my first article on the subject when I was chairman at USC. The problem is not the clear-cut case that you see in dental practice. It's the hidden cracks. The hidden cracks under restoration, under crowns, in the root structures. We know for sure a very intimate relationship between the cracked tooth problem and endodontics. Specifically, abusive endodontic treatment and abusive restorative treatment. Cracked teeth, you could have unrestored teeth, we've seen them. But most of the cracks we know about today are associated with some form of dental treatment. That's very important. And therefore, I have dedicated this series of master classes. Thank you for mentioning that, because I think the problem is really misunderstood. The problem is not appreciated completely by the practicing dentist. Back in 1964, Cameron, who introduced the cracked tooth syndrome definition, criticized the profession that the problem is not taught in dental schools and dentists not aware about it. Unfortunately, Cameron in 1964 did not define it, did not define what is the cracked tooth. The lack of definition of what is the cracked tooth created many problems because we don't have a clear definition. You're not going to be able to diagnose. And when you're not going to diagnose, you're not going to provide the appropriate treatment. So, and today with online prevalence of unedited material, we see a lot of misunderstanding of the problems. 53 years later, where we are today, we still have a lot of lack of awareness of the problem. The problem, however, as one Dr. Clark has stated, is becoming epidemic. Thomas Hilton in Oregon, conducted a very extensive studies of 15,000 teeth 3 years ago. And they found the incidence. He had like 40 dentists, 49 dentists participated in his study. He found the incidence is about 60% of the population has at least 1 molar cracked. 10% of those will become symptomatic. So the problem is with us and increasing. And therefore, I dedicated this to clarify it and develop better understanding of the problem for the practicing dentist. And
that's fantastic.
Focusing on the relevance between endo and the problem.
Yeah, I think it's a common problem, certainly in my practice, when you have patients that come in with various symptoms and you start to run through, well, is this a periodontal issue? Is it an endodontic issue? Is it a cracked tooth? And it's something we all struggle with, I think, from a diagnostic standpoint. So I've watched the first part of this course, of this series, the 4R operational diagnosis protocol, and I can't thank you enough. It really takes you through, as a dentist, reminds you of the biology that's going on underneath, the histology. It takes you through from start to finish how to identify where pain is coming from, what could be causing it, and then how to walk through that diagnostic process. Can you, just to give a taste to our audience right now, can you briefly go through what the 4 R's are, and just from a very big picture standpoint?
All I could say to you that I have tremendous respect to the Scandinavian literature, Scandinavian research, and the Swedish Council on Research back in 2012 indicated that the current methods and tools we have in diagnosis of endodontics are non-evidence-based. They're not valid. And I knew that problem back in the 80s as a teacher, as a practitioner, as a clinician, as a researcher. And therefore, back then, I wrote that article about the integration of the idea that one test is very dangerous. And therefore, we must combine our testing. And what do we have? We have the patient telling us the story. We have explorer, mirror. That's all we have. And that's not enough. We have an X-ray. So what I've done with the 4R proposal, I integrated the patient's story of pain with the radiograph findings, with the pulp testing, period testing, and most important, the last part, get in and see what is going on. Looking at X-ray is not enough. Talking to the patient is not enough. Performing pulp tests is not enough. The only thing enough is operational, is to get in, give this patient injection, anesthesia, get in, remove the restoration and take what's underneath it. Remove the crown, see what's underneath. Lay a flap, see what's underneath. That's the whole idea. So when you integrate those things together, you come up with definite diagnosis, not tentative. I don't like tentative. It's definitive. So by the end of this diagnostic interview, you got something to tell the patient. You give them feedback. You know exactly what's going on. When you remove that restoration and all the amalgam, and you see a line crack in the axial line angle with the pulp floor, you know what to do. But you know, we have so many, because of that definition of what's a crack, there has been so many unintended consequences. Do you understand that? What I mean by that, when we have an amalgam restoration, MOD, and the guy wants to do a crown, they don't remove the MOD. They cut the crown over it. Underneath that restoration, there's a crack.
Right.
Propagate, and then breaks a cusp, and then we start leakage. When you know, the era when we remove amalgams and we put composites, to me, the biggest service to a patient when you remove an old amalgam and place a composite is to examine for the crack. We were in dental school, we taught how to detect caries, period problem. But cracked teeth examination must be a routine. Cracks you're not gonna find unless you look for them. Yeah. And we were not to look for them. That was not part of the protocol in dentistry. And if you look for them, you find them.
Well, again, I can't thank you enough. I really enjoyed watching the first part of the series. I'm looking forward to watching the rest and taking the rest of your master class. I can tell just from the first part that this course will be able to inspire that confidence that you were talking about for dentists. Diagnosis and treatment planning is the cornerstone. There's no technology that'll save us if our diagnostic and treatment planning skills aren't intact. And from an endodontic and cracked tooth standpoint, this, I believe, is the course that will give us that.
Very good, very good.
The course can be found at the Dental Academy of CE.com. And Dr. Marwan Abou-rass, thank you again so much for putting this course together. It must have been tremendous work, and it's really superb. Thank you.
Thank you, Chris, so much. Thank you.